Now, how do you analyze? You were talking about the woman that we saw, she was recovering from liver cancer. Is that what you said?
Yes.
And how do you decide what acupuncture points to use, and how do you decide exactly what did you decide she needed?
Right. That I read her pulses, for one thing. I also listen to her story. She had quite a long story of her everything that has happened to her in her health, several surgeries. All of that becomes important, all goes into the mix of deciding where is going to be the places, the locations on her body where I can bring her the most benefit. And since the liver is so involved in producing blood, and because she had a lot in her menstrual history, there was a lot of problems. So I knew that that was one thing I had to do, and the moxa is particularly useful in women's health for her blood issues.
Let me ask you about the acupuncture. We were talking about meridians before, and how is acupuncture connected with meridians? Are you what exactly are you trying to do when you use a needle, when you find a point? Okay. Is that connected with meridians somehow?
Oh yes, it's the idea. I think the easiest way to look at it is like a river. The body has these rivers of energy, and they get blocked just like natural rivers do. And from lifestyle, from sometimes people's overuse of medications, I hate to say that, but sometimes it does happen.
And this is what's confusing to Westerners, because we can understand blocked arteries. That we know, right. That we understand. And you can see a blocked artery, but in Chinese medicine, they talk about blocked meridians, these blocked flows of energy. That's right. What you're describing.
Yes.
And that's a concept that it's very difficult for Westerners to understand. We don't even have words to describe it.
True. And that Chinese medicine has that missing way that we don't have of looking at what you can't see and figuring it out. And so many times people who have they've done all the diagnostic tests, and they are certainly useful to do, and we should all do them. Especially when something is wrong, but it may turn out that they say, well, we can't find anything, yet the person is still suffering some kind of discomfort. And that's usually when they start thinking about acupuncture. And
how do you use herbs in conjunction with the acupuncture and the moxibustion that we were looking at?
That's more used as something that the people will take home with them to help them so that they don't need to come in. I think one of the real useful ways for herbs that they don't need to come in as often for treatment, or let's say they're going to be traveling and they can't come in, or they're maybe moving to another town and they won't get to an acupuncturist right away. This is a way for a person to maintain what is happening during acupuncture treatments, and particularly with certain things that are quite responsive to it, such as difficulties with the bowel, such as irritable bowel and
which is a
digestive.
very difficult for Western medicine to treat. Chronic ailments are hard. Irritable bowel is hard, and so you're saying that the Chinese are able to treat a chronic ailment like that with a combination of acupuncture and herbs?
Yes, quite often. I will say many times there is a psychological component, and that needs to be dealt with, and we're not really trained in that area.
So let's talk a little bit about Chinese herbs, and there's some that Westerners know, and one of the biggest ones they know is ephedra, because it was in the news so much of people really having very, very serious reactions to it. So what kind of cautions can you give people, because this is medication that we're talking about, and often you can buy it on drugstore shelves, and how dangerous is that, and should you always go to someone who is trained and licensed to give you these drugs?
Yes, Chinese herbal medicine is quite a detailed study, and I sometimes think it's even more detailed than the study of acupuncture. So therefore, it is quite dangerous for people to be self-medicating with Chinese herbs, or to think that, oh well, these are herbs and they're safe and I'll just take as much as I want. It's not true, because, for instance, ephedra is used in a formula that is usually used for breathing. It's not used for weight loss or for a quick energy pickup. It's for the lungs and for breathing.
How did Westerners ever begin to use it for weight loss? How did that
I
even
think
happen?
just fooling around, that someone found that they could take a whole bunch of it and get a quick burst of energy. And that's the way a lot of Westerners have used ginseng too, which is not how it's used in Chinese medicine.
Let's take a look at one of your patients. Let's see, she's going to be talking about sinusitis and how you treated that for her.
Right.
And then we'll talk about what she has to say.
I try to seek out a Chinese acupuncturist and herbologist, and I just got very, very good results over a period of time, and it made me really, want to continue that type of treatment. Frances has been treating me for the sinusitis and other things with the acupuncture. So she'll, put various needles in, different protocols depending on what's going on. Usually she'll treat my sinusitis, sometimes, just other things. If I have a cold or a backache or anything like that, she can treat. And in the past I've also taken herbs for, various things as well, the sinusitis and, if I'm getting a cold, the flu, anything like that. In general, when I'm healthy, I go to acupuncture once a month just as a kind of maintenance thing. The idea is that if toxins kind of build up in your body, it's good to release them once a month, and it prevents you from really getting sick very often. While I'm laying there, I'll actually my sinuses will start draining, and I'll start to feel less of a headache and some relief. I've had a number of sinus surgeries as well, but since starting the acupuncture, I haven't had any more surgeries.
That is fascinating to me, because when she described having sinus surgeries, which is something that, in Western medicine, often we go into surgery, especially if there's a blockage and medication isn't working and someone is, this is a chronic problem. And yet what she's describing, it seems to me, is she's gotten more relief from this very non-invasive therapy of acupuncture. Right. And how do you explain that? How would an acupuncture treatment clear sinuses? Can you explain how that works in the way we can understand how surgery might unblock sinuses?
Well, there are two meridians that go, or three actually, or more, that go up through this part of where the sinus congestion happens for most people. And so I would treat on those pathways. So, for instance, the stomach meridian comes up, enters into the body right about here. So I'm talking about the points that I would use that are local. And I also use distal points, so I'll go further down on the meridian, way down on the leg too, because those are some of the most powerful points of the meridian. And then the lung meridian, which runs on the arms. That one, I'll also use that because that will free up the breathing in the chest. And what you want to do, the approach is to get things moving. What's happening is that, normally a person should be able to feel something up there, blow your nose, and be done with it. But the problem is with that is usually it stays up there and it becomes very thick and very hard to move. And then it can be further loosened up by taking Chinese herbs.